Good evening. Thanks for joining us. I'm Angela Taylor.
And I'm Rod Carter. Kids now make up nearly a third of COVID-19 cases in North Carolina. That is the highest percentage we've seen since the pandemic began.
Today, there were more than 4,700 new cases. The percent positive reached its highest level since January at 15.8%, and 63 more people died from the coronavirus in North Carolina.
The number of people in North Carolina hospitals showing some signs of stabilizing right now. There are more than 3,700 people seeking treatment. That is actually down 20 from yesterday.
Now, the number of COVID clusters in North Carolina schools jumped by 70% in just the last week. 125 schools now reporting those clusters.
CBS 17's Bridget Chapman is live tonight after finding out how educators and health experts are reacting to that. Bridget.
Yeah, Rod, Angela, as you mentioned, more kids are getting COVID in North Carolina, and we are starting to see and hear about those clusters pop up in the schools. Now, health experts say they expected this to happen as students did return to the classroom, but said it's important now that everyone stay diligent.
Mandy Barker is happy to be back in the carpool lane for her two kids at Westlake Elementary School.
They are happy. I'm happy. You can just see leaps and bounds. I'm just so pleased that they're back in school.
The school is one of many tracking potential COVID cases on campus, but has no confirmed ones yet.
The teachers, the principal have been very clear, communicative with what the expectations are for them.
The Wake County Public School Systems reported a dozen COVID clusters at other schools in the past month. The state says there are more than that in schools overall in the county.
Our educators are hyper-focused on making sure that masking compliance is happening with fidelity in their classrooms.
Kristen Beller with the Association of Educators says the vulnerable times are lunch and recess, where kids might not be social distancing or masking.
Unmasked exposures means quarantines, right? So the impact goes farther than even just whether or not you have actually contracted COVID-19 yourself.
As of last week, 31% of COVID cases in North Carolina are people under 17 years old.
So as we see cases increase in the community, we expect that we will see cases trickle down to kids.
Dr. Ibukun Kalu says because those under 12 can't get vaccinated, it's even more important for those who can get their shot.
If we do not get rates as high as possible, we will unfortunately continue to see spread and unfortunately see that trickle into our vulnerable kids.
Health experts say it's important to keep tracking the numbers in schools and pinpoint exactly where they're coming from to make sure the different protocols in place are effective. Doctors say that if they are being followed, if they're masking up and doing what they're supposed to, these numbers should start to go down. Reporting live in Raleigh, Bridget Chapman, CBS 17 News.